Welcome to the Candidates Forum for the Hampden District, which includes all of West Springfield, as well as parts of Springfield and Chicopee. Food for thought, justice, and health equity. The candidates are Adam Gomez and Jim Welch. The candidates will be moderated by Mike Dobbs, Managing Editor of the Reminder Publications. Sponsors include the Food Bank of Western Mass, Springfield Food Policy Council, the Urban League of Springfield, and CISA, Community Involved for Sustaining Agriculture. And please remember to vote on September 1st.
Thank you for coming tonight to the second Hampden and Hampshire Virtual Candidates Forum. I'm Laura Sylvester from the Food Bank of Western Massachusetts, and we're excited to have Senator Jim Welch and Councilor Adam Gomez here tonight to talk about issues that are important to the district's voters. Councilor Gomez is challenging Senator Welch in the Democratic primary, which takes place September 1st. The deadline to register to vote is this Saturday, August 22nd at 8 p.m. You can register online at the Massachusetts Secretary of State's website. We have early voting and vote by mail now in Massachusetts, so no need to go in person. You can get all of this information and more at the Secretary of State's website. This forum is being broadcast live on Focus Springfield and YouTube. The rebroadcast will also be translated into Spanish. Now I'd like to turn things over to our moderator for the evening. G. Michael Dobbs is the managing editor of Reminder Publishing, which produces 5 weekly newspapers serving 197,000 readers. Dobbs is a proud Springfield resident, and we are pleased to have him here tonight. Take it away, Mike.
Thank you very much. So we're going to have 2 rounds of questions tonight. Round 1 will consist of 6 questions. Each candidate will have 90 seconds to answer. Only the candidates will get to see Christina Maxwell of the Food Bank of Western Massachusetts, who is the timekeeper. We will cue you at 30 and 15-second marks to wrap up your answers. When your time is finished, you will hear a bell. There it is. So please keep to the allotted time. Now, round 2 will be somewhat different. There will be 12 questions, and each candidate will answer 6 of the 12 questions and have 90 seconds to answer. At each turn, the candidates will choose a number between 1 and 12, and I will read the corresponding question. Each question can only be answered once. Again, Christina Maxwell will hold up a board so you can see which questions, that is for the candidates, have been chosen and how many remain. After round 2, we will have closing remarks from each of our 2 candidates, and they will have 90 seconds for those remarks. So let's talk about the candidates. It's City Councilor Adam Gomez Sr. from Springfield and incumbent State Senator James Welch from West Springfield. Adam is the father of 3, a small business owner, and a tireless advocate for veterans. He was called into politics as a grassroots activist and organizer with Neighbor to Neighbor, a member organization led up by people of color, women, immigrants, low income, and the working class that focuses on economic, racial, and environmental justice. Now, in his 3rd term on the Springfield City Council, he serves as the council's vice president, the chair of economic development, and is on the committees for casino oversight, finance, environment, and sustainability. Adam has experience working at the local, state, and federal levels for the benefits of his constituents. Now, Senator Jim Welch is the father of 2, and he was first elected to represent the Hampden District in 2010. And this includes his hometown of West Springfield, and as well as neighborhoods in the communities of Springfield and Chicopee. Jim is the Senate Chair of the Joint Committee of Financial Services and Senate Vice Chair of the Committee on Consumer Protection and Professional Licensure, a member of the Committees of Telecommunications, Utilities, Energy, and Marijuana Policy. Prior to the Senate, Jim was elected to the House in 2005, where he served on financial services, and he was the Vice Chair of Bills in the 3rd reading. He launched his career in public services as a West Springfield City Councilor. Before he held public office, his education and private sector experience focused on finance and banking. He graduated with a Bachelor's of Science in Business Management from Westfield State University. So we have gone alphabetically to figure out which candidate gets the first question. answer, I should say. So we're going to start with Councilor Gomez. Here is the first question. There are already programs implemented to address food insecurity in the district, the region, and the state. What's working well? What isn't? What would you do to fix or improve programs to make them better?
All right. Thank you. I want to first off say thank you to everyone and Senator Welch for participating and Focus Springfield for having us. Well, we know that we have breakfast after the bell. Springfield Public Schools is 100% free and reduced lunch. And we, of course, are grateful to receive that help. And I want to thank the Senator for supporting that initiative. That said, if you speak to any teacher or student that opens those breakfasts, you know that they are far from nutrition, and our students need more than just cereal bars loaded with added sugar, or that's just not going to cut it. And as your next state senator, I want to build on programs to ensure that our students and our teachers are having nutritious breakfasts so they can have successful days, successful school days. There's also, the healthy incentive program that exists that we know that, help with covering costs when it comes to eating fruits and vegetables, which I know that, $60 isn't enough. There's also the Massachusetts Emergency Food Assistance Program that exists. And I also believe that I would introduce legislation to require that all food waste from other grocery stores that are donated to local non-governmental organizations and other charities who help feed the poor. I think that, we're having a collapse when it comes to our food and making sure that our communities of color and our rural communities are getting adequate food access. Thank you.
Okay, thank you, sir. And now Senator Welch.
Well, thank you, Mike, and thank you to everyone for hosting and putting this forum together, and thank you to Adam as well for being part of and running a spirited campaign. It's not an easy thing to put your name on a ballot, so I certainly commend him for that. And I again want to thank the sponsors in Focus Springfield for putting together tonight's event. The Healthy Incentives Program is a tremendous program that we just recently made sure that there was complete funding for. Basically, the Healthy Incentive Program is a program that basically connects inner cities with rural farms and rural places that grow vegetables, and making sure that there's a connection there, and that people who live in this inner city, especially if you were talking about children or school-age kids that are having access to these healthy vegetables, fruits and vegetables. So the Healthy Incentives Program is one program, obviously, that we need to continue to build on. We need to make that a program that is in perpetuity. Right now, it's a program that we have to fund every year. So I think the commitment in that program would be to ensure and put in statute to make sure that that program remains funded and remains part of state government for the foreseeable future.
Thank you very much, sir. Now, we're going to have several questions tonight that have been developed and submitted by the Springfield Food Policy Council. And this is the first one for the discussion this evening. And we will go to Senator Welch for the first answer. What is your understanding of how food access and food insecurity affects the public health of our communities? Senator?
Well, it's a great question, and healthcare and people's health is completely and entirely reliable, and many times on the type of food that they're able to access and they're able to eat. I spent 6 years chairing the Committee on Healthcare Finance, and one thing that stuck out to us was the fact that there are many disparities when it comes to the access of food for people, especially in inner cities that live in what are called food deserts. I filed legislation to establish a commission and to establish basically an effort to make sure that every food desert that's identified in Massachusetts right now would have the ability to have a grocery store that sells fresh fruit and vegetables. Without fresh fruit and vegetables and fresh food and access to good healthy food, we all know that unfortunately, people's health declines if they don't have the access to that food. The Fit Body and Soul program in Springfield is a tremendous program that focuses on our youth and focuses on their lifestyles in terms of trying to encourage them to eat healthier, especially with the prevalence of diabetes, especially amongst our youth. So those are a couple programs that I think we can continue to look at, but access to healthy food is a direct correlation to somebody's health.
Okay, Councilor Gomez, it's your turn.
Please repeat the question.
Absolutely. What is your understanding of how food access, food insecurity affects the public health of our communities?
Thank you for that question. It's no secret that we know that in communities of color that there's complete food deserts. I have been to plenty of town halls and canvassing, and number one thing that I hear from our seniors is that there isn't enough food, healthy foods for them to be able to eat nutritiously. Me, myself, the senator had brought up that, diabetes and pre-existing health conditions. Me, myself, being diabetic and suffering from some of those things, eating healthy is important. And specifically when it comes to kids, knowing that, in communities of color, the obesity rate and also when it comes to these pre-existing conditions are tremendously high. Proper nutrition and proper health and, food desertification, and access to farmers markets are essential. Working with gardening from the community and other initiatives across the district, which now in Chicopee, they're trying to start like a local farm so we can teach people in the inner cities and these areas to learn how to grow fresh food to make sure they can have access to fresh food. The issue is that a lot of our communities where we have a lot of these stores, quote unquote bodegas, a lot of the bodegas, when it comes to SNAP benefits, that food to eat healthy costs way more than, let's say, food that's unhealthy.
Thank you very much, Councilor. For our next question, and we will go right back to Councilor Gomez. Since farmers struggle to make a living, and so many of our neighbors here in the district struggle with food insecurity, what ideas do you have for getting locally grown food to our neighbors who do not have enough food?
Thank you for that question. Well, at home, traditionally, my father's father was a farmer, my mother's father was a farmer. So we want to be able to educate first in our school systems and have programming on gardening to teach kids that in their backyards, they can start off by growing tomatoes, lettuce, corn, and different other types of vegetables. But at the same time, looking at different initiatives like gardening in the community in Ward 4, and also what I have mentioned in Ward 2 in the city of Chicopee, and these initiatives to really work with these different folks that are starting these different gardens. I think it's important for us to then create spaces where farmers from outside of the region can come in, and we can create farmers markets that are just pop up and where people can come together safely. I know under the pandemic, we have been really under a microscope and trying to make sure that we're social distancing, and those things haven't been relatively easy to do. But I think once that we can get over this and flattening the curve, that I think we can get more into that ideal and working with, Putnam and working with our schools to really introduce programming on healthy eating, specifically with learning and teaching them how to grow. That's something that was essential in my life, and I know that's something that I can really work towards and look forward to championing when it gets to the state senate. Thank you.
Thank you, sir. Sandra Welch, same question. Oh, you have to unmute yourself, sir.
Yeah. Would you mind repeating the question for me? I appreciate it.
Absolutely. Since farmers struggle to make a living and so many of their neighbors struggle with food insecurity, what ideas do you have for getting locally grown food to our neighbors who do not have enough food?
Well, again, the Healthy Incentives Program, I think, is one of the #1 examples of what we can do in the state and have done to connect and to make that connection between our rural friends, farmers, people that grow their own food, and be able to provide access to those healthy alternatives, like in cities of Springfield, Chicopee, and West Springfield, for all people who don't have access to food. The more and more we can do that, and then increase the amount of vendors that are supplying that food, I think is in the long-term goal, will just create that many more opportunities for people to be able to access healthy food. So I'm a real strong supporter, of course, of the Healthy Incentives Program, because I do feel as though it is aimed at trying to address exactly what your question said about connecting rural with people who live in the inner cities, and providing people who don't have access to healthy food, provide them that access.
Thank you, sir. And for our next question, we'll go back to Sandra Welch. Anyone who lives in Western Massachusetts understands that there are disparities in funding, infrastructure, wages, employment, broadband, and other issues between the eastern and western parts of the state. What do you think are some of the most serious disparities, and what would you do to overcome them?
Well, one of the most serious disparities are health disparities. And, as I mentioned again, I chaired healthcare finance for 6 years, 3 terms. And one of the first things that, as you dive into healthcare statistics, one of the first things that really slaps you right in the face, and we have plenty of data that backs it up, is that there are healthcare disparities, and that our communities of color don't have the same results when it comes to being able to access proper health care, and being able to access the right services when they need them. So health disparities, for me, it's something that I've worked on trying to correct and trying to work to make better throughout my entire career. I'll continue to do so. We have a lot of work to do in that respect, but there's absolutely no reason why one person who lives in one end of the state as opposed to the other end of the state should not have access to the same type of healthcare services as their peer in another location. So we have great healthcare services here in Springfield, absolutely, in Western Mass, no question about it. But we're a Commonwealth, and the Commonwealth needs to provide all the same healthcare opportunities and services to everybody, no matter where they live.
Thank you, sir. Councilor Gomez, same question.
Thank you. If you live in Western Mass, you already know that at Beacon Hill, it feels like Western Mass is an afterthought. We know that our delegation, does and tries as hard as they can, but we need bold leadership who will not just only deliver for our district, but will fight every day for all of us, not just the town they live in. I think that we have a lot of infrastructure issues that are going on in all 3 respective parts of this district when it comes to the municipalities. Me as a city councilor, we know that we go through tremendous economic regional disparity. We know that when it comes to the East to West Rail, connecting us to each other just brings economic opportunities. Public transit, when the PVTA wanted to cut down on their stops, we advocated and fought for it to make sure that we had all those stops not removed. PVTA shouldn't matter less than MBTA. The mental health services at Providence Hospital, closing of birthing centers, closing of hospitals, and at the end of the day, we need to show Beacon Hill that we matter. Western Massachusetts, and knowing the disparities that do exist, and being the most economic challenged district in the state of Massachusetts, says a lot. And I know that that's something that I want to champion to bring more effort to bringing more resources back to the district. Thank you so much.
Thank you, sir. Now, this question is another from the Springfield Food Policy Council, and Councilor Gomez will get first crack at it. COVID has shown us more clearly than ever the relationship between food access, diet-related diseases, and negative health outcomes for those who get this virus. What would you do to address any of these issues?
Well, first, I think one thing we have to be relative to is the fact that, I am one person, but at the same time, collectively, we can come together and bring our public health institutes and our food banks together to have these conversations so that we can legislate on a good foot. We know that testing is the most important thing that we need right now, specific to anything west of 495. We need to get the virus under control, and that begins with knowing who has it. And then of course, when it comes to trying to get food, I know that folks have been investing in trying to get to Instacart, but Instacart doesn't take SNAP benefits. I know because, I have a lot of my district that had those troubles and woes, that they had to put themselves in jeopardy to ride the PVTA, to get to the food, to the nearest supermarket, which in my district, food markets are a dime a dozen. They're usually out in West Springfield or up top on top of the hill on Boston Road. So I want to introduce a resolution I've already introduced a resolution that declares racism a public health public health emergency, in Springfield. And I plan doing the same thing on the state level if I'm elected. But we have to make sure that when it comes to testing and proactivity, we're doing everything possible to make sure that we have all the resources to get our communities back on track.
Thank you, sir. Senator Welch.
Thanks, Mike. Would you mind repeating the question, or at least the 3 points that you had?
Not at all. COVID has shown us more clearly than ever the relationship between food access, diet-related diseases, and negative health outcomes for those who get this virus. So what would you do to address any of these issues?
Well, first and foremost, COVID-19 has been a challenge for everybody across the country. Obviously, for us in the Commonwealth, and especially for us here in Western Mass, although we weren't hit as hard as our counterparts in the eastern part of the state, bring resources back to your communities. But it's really important to make sure that that money gets into the hands of the local organizations that are really serving the people on the ground level. For example, Fit Body and Soul was one program that I mentioned earlier. New North Citizens Council is another organization that I've been able to successfully bring funding back for. Martin Luther King Jr. Family Center, who does provide some great programs, been able to secure funding for them as well. I personally believe that sometimes when money gets allocated, and if it's not directed specifically to certain neighborhoods, oftentimes that money doesn't find its way to the neighborhoods that we're actually trying to pinpoint and bring resources back. So I'll continue to fight to bring money back, to put it into our communities, to make sure it's getting directly into the communities to fight all of the challenges that go along with it.
Thank you very much, sir. So this is our last dual question here. Our district traditionally has low voter turnout. Why do you think this is? And can anything be done to address it? And this goes first to Senator Welch.
Well, I think we've done some great things this year. I think we were prompted. Unfortunately, it took COVID-19 to get us to the point where we, made mail-in voting and early voting much more accessible for people, and mail-in voting for the first time. No no fault or no fault absentee ballots, the more and more we can make voting accessible. There should be absolutely no reason why there should be any hurdles in front of anybody to be able to cast a vote. The more and more technology that comes our way, hopefully the more and more we'll be able to utilize that to our advantage to get people to be able to utilize those services to be able to vote. But I'm very proud that we've taken, on the state level, the legislature passed the mail-in voting law, for this election season. And again, the early voting for the primary a week before, which is great. For the general, I believe it's 10 or even 14 days before. And the more options, and of course you always still have the option to go on election day and vote at your normal polling location, but the more and more options we can provide people to be able to vote, the better the turnout should be. And we have to continue to educate people about how important it is to cast your vote, and not only cast your vote this year, but we got to make sure everyone gets counted in the census as well, because that's very important for our region.
Okay, thank you. Now, Councilor Gomez, same question.
Thank you. I pride myself on the voting initiative, and I pride myself that last June that the Springfield City Council was one of the first municipalities to pass a resolution on vote by mail. And I want to thank our legislators that made that a reality. But also when we're talking about voting access, there's also a piece of it that we need to work on, is that same day registration or same day voting. I think that language barrier plays a big issue. I know that we do what we can to make it bilingual, but essentially we only use our assistance into the Spanish language, which Springfield is a diverse city that has so many different languages, and I believe that more canvassing. I know that last year, the Springfield City Council, we initiated a notification for municipal elections. I would love to champion something on the state level that we can notify people when the elections happen, because majority of the time, some folks really aren't aware, because, everyday life is stressful. Everyday life has its spins and its whirls. And sometimes people, I've had to, watch before I was a counselor, when I was an organizer, watch their children or watch what they're cooking so they can go head out. So they got to have time to cast that vote. So we have to make it as easy as possible. And voting by mail is just one of the first steps. And I hopefully that not only this year, but for the rest of our time, we can vote by mail.
Thank you. Okay, so now we go into our second round. And what's going to happen once again is each candidate is going to give us a number between 1 and 12. And we will then, I'll read out the appropriate question. Christina Maxwell is holding a grid, and when the question is eliminated, she will take it off the grid so everybody will know where we are in the process. So I'm going to go with Councilor Gomez back and forth here. What number would you like to try, sir?
I'm going to go with the number that follows me my whole life, my line number 6.
Number 6. Okay. Here we go. How important is it to you to support early childhood education? Will this be a priority for you in the legislature?
Absolutely. I have a 3-year-old daughter. Early childhood education is paramount. It's paramount to make sure that they're reading at the level by the 4th grade. I know that there's been plenty of initiatives that we've been partnering with when it comes to the Davis Foundation, but this is a no-brainer. We know that in communities of color that an education, a degree, is the passport out of poverty. So that is something that I plan to champion, and also to make sure that we fully fund our school system and get that formula straight so we can get what we deserve. Thank you.
Thank you, sir. Okay, Senator Welch, you pick a number between 1 and 12. Oh, you have to unmute yourself, sir.
How about lucky number 9?
9. Okay. I feel at some point I should be yelling bingo. Okay, here's lucky number 9. Despite the fact that there are 15 states allowing immigrants who are lacking a legal status to get a driver's license. Massachusetts is not one of those states. What is your position on passing this policy to get a license?
It's a great question, and something that in Massachusetts has been talked about and advocated for many years. I've come around to believe that we'll be safer as a community if we do provide an option for people to be able to gain licenses. When you really think about it, you know, if a person who does not have the ability to get a license, but they're still going to drive, if we provide an avenue and provide a way for them to be able to obtain their license, one, they're going to be better trained, more likely to have, you know, automobile insurance.
Okay, someone didn't mute their phone.
Not me. On that issue, I think for safer communities and for to ensure that you know, our communities are as safe as possible, you know, we have to recognize and be honest that people, even if they don't have the ability to access a license, if they are of age and they have to work, more than likely they have the access to an automobile, they're going to drive. So let's make sure that we're providing them safe training, proper training, providing access to insurance, and you know, that way we'll have a much safer community and people better prepared to drive on the roads.
So, Councilor Gomez, it is your turn to pick a number. What number would you like?
My son was born on March 12th.
Okay. Question number 12, which is from the Springfield Food Policy Council. What is your position on mass health? Do you think it meets the needs of all residents who are not privately insured? What would you do to propose to increase access and affordability?
Okay, I just wanted to make sure I was off of you.
Okay.
All right, so mass health is something that I utilized before I was a council member. Before I was a council member, I utilized mass health. My children utilized mass health. And one thing that we know that is important is buying into the ACA if we're employed. And when we're employed, sometimes we don't have adequate coverage, and we end up with surprise bills. We end up with more costs, we have to figure out if we're going to pay for medication or if we're going to pay for food. I think that's where we come in together when we're looking at the SNAP gap, you know, and trying to bring it to its forefront. Medicare for all, single payer. That's something that I plan to also, you know, work on with the fellow senators that are working on that already at the State House. I think that is a conversation now with the disparities that have been created pre-pandemic, and now the exacerbated issues that now we know we need single payer more than ever. But I believe that, you know, healthcare is one of the paramount and most important things when it comes to Hampden County. Just at a standout, I was joined by a woman from Chicopee. She was an independent, and she was telling me how she had to get a second insurance because her insurance that she had didn't cover all of her expenses, and that's unacceptable.
Thank you, sir. Okay, Senator Welch, your turn to pick a number.
Lucky number 3.
Okay, 3, which is another question from our friends at the Springfield Food Policy Council. How are you working with or communicating with organizations in the district that serve low-income and food insecure constituents? Which organizations are you in contact with? And what have they told you about hunger in the district?
A great question, and I know that I mentioned a few of the organizations in a prior question that I work with and help provide funding for, to help them provide the services and the resources for people that need it. One of my favorite days, and when you're in the legislature and in your district, you get invited to local lobbying events. in Springfield, West Springfield, and Chicopee or Western Mass, and organizations come together and they lobby you. They basically say, hey, we need resources for the SNAP program, or we need resources for the Healthy Incentive Program. But the Food Consortium group comes in and, instead of kind of speaking at us, asks us how we can help them learn a little bit better about how to lobby and how to get the message across to legislators all across the state. And it's a lot of fun. I've done it the past few years, and it's a great way to connect with people. And when you talk to the people that are there, they're the ones that are on the front lines, really providing the services and really being there every day when people need them. So I believe that's a great example and a great way to be able to connect with those organizations in a way that you feel as though you can be helpful.
Thank you, sir. Councilor Gomez, time to pick a number.
I'm going to pick my birthday, June 5th, number 5.
Number 5. Okay. And this question is also from the Springfield Food Policy Council. Which State House committees do you see as having the highest priority for you, and on which would you request to serve?
I think I would love to serve on healthcare finance. I think that's one of the ones that I'm looking forward to. Hopefully I can get involved in veterans, because what's been going on at the Holyoke Soldiers Home and with Providence Hospital has been one of the most alarming issues and concerns of my time. It's not a secret that I work. My profession is in veterans case managing and property management, getting veterans out of homelessness. Also, when it comes to affordable housing and getting folks into adequate housing and making sure that tenants are getting their fair shot in court. I think that when it comes to our healthcare system, it's broken. Also, when it comes to our housing system, it's also broken. And those are the two one of the two major issues that I think that I want to champion outside of immigration, and making sure that we can make Massachusetts a safe state. It's not a secret that I made and brought forth the Welcoming Cities Ordinance here to the city of Springfield, making sure that Springfield is a safe place for all migrants and immigrants, documented and undocumented, to feel safe and to be involved with the community when it comes to city services. So those are kind of particular issues that I look forward to really working for, and making sure that we have a voice that's loud, and making sure that we can negotiate at the table to make it all work for our people.
Thank you, sir. Senator Welch.
How about 11?
11. The Healthy Incentives Program, or HIP, has provided access to locally grown produce for 70,000 households in the Commonwealth who face hunger. And they've done this by piggybacking on SNAP. However, those 70,000 households represent only 7% of all SNAP households. What would you do to continue the growth and the funding for this HIP program?
Well, it's a great question. I think we've spent definitely some time talking about the Healthy Incentives Program tonight for good reason, because it's a program I think that we in the Commonwealth, as I stated before, I think the best thing we can do to grow that program is to ensure that it's not something we have to fight for every single year, the funding for it, and to put it in statute. That's why I've sponsored Senate Bill 48, which is an act relative to an agricultural healthy incentives program, which is filed by Senator Ann Goby from Spencer. And it's, again, a great program. We're all talking about it tonight. We know and we see the benefits of it. Let's make it something that will be in statute, and let's make it something that we can count on for many years to come. And as I stated before, the governor just announced an increase in the amount of vendors that are going to be as part of this program, and it's a tremendous start in the right direction. I believe there's 7 or 8 of those vendors that are going to be based in the Springfield area. And it's a great program that we've seen very good benefits from. And the more and more we invest in it, and the more and more we build it up strong, excuse me, the more positive results we're going to see.
Thank you, sir. Councilor Gomez. Board is getting increasingly empty here.
Absolutely. So we're going to go with Ward 1 to create one Hampden district. Let's go. Let's go with number 1.
Okay. Question number 1. How would you address social isolation and food insecurity for older adults during this pandemic? Understanding that people over the age of 65 and those with certain health conditions are safer at home to minimize risk and exposure.
That one was one that we were championing with my colleagues on the city council, is making sure that the elderly and our seniors were getting food access. We knew that we had closed down all our senior centers, and for a long time, our seniors, since the pandemic, haven't had access to recreation. When it comes to food, we know about the Meals on Wheels program, but traditionally, some of that food isn't to purview of people's ethnic background. I know that the city is doing a lot of that work, making sure that still they're serving our seniors and our children. But I believe that working with our elderly factions inside of our municipality, sorry, I don't have the word at the moment, but in our municipalities, to make sure that they're fully funded. I know that a lot of our restaurants and small businesses, even though that they've been struggling, have been stepping up to the plate and creating mutual aid funds. And those are things that I'm looking forward to being able to support, but also elevate that sometimes in a community, government really fails us. And I think moving forward, we just need to make sure that our neighbors are looking out for one another, but moving forward, that we have to be champions when it comes to our seniors, because they gave us the reason why we're here. So that's it. Thank you.
Thank you, sir. Okay, so Sandra Welch, time to pick a number.
Let's go with 10.
10. Okay. Sandra, what is your number 1 policy priority, and what are a few concrete action steps you would take to further that priority?
I have to pick just one. And I've been asked this question before, and it's hard to pick one, but right now I'm focusing on ending surprise billing here in the Commonwealth of Massachusetts. We as a Commonwealth have a very strong healthcare system, a model for the nation. As we know, Massachusetts was the model for the ACA program, something we're very proud of. And it's a program, our Massachusetts healthcare program, provides coverage to 98.5, almost 99%, and all 100% of all children in Massachusetts, which we're very, very proud of. But surprise bills are something that I think we can address on the state level, especially because it's not fair for someone to go in and have a procedure and, have the belief and understanding that when they go in for their procedure, that their insurance is going to cover steps 1 through 10 or steps 1 through 15 of that procedure. But too often than not, one of those steps, unfortunately, falls into, for no fault of the patient, falls into or outside of their insurance coverage. And after the procedure is done, a few weeks after, a few months after, patients get large bills. And I've filed legislation, I've passed legislation in the Senate in previous years to address this. I think it's something that we need to finally get past, and I look forward to doing that.
Thank you, sir. Okay, so Councilor Gomez, we have 4 questions left. Which one do you want to take?
I'm going to take 8.
Number 8. Okay, so I think that both the senator and councilor know that I live here in Springfield, and I live just a little ways away from Focus Springfield, right off of Central Street, and there isn't any sort of supermarket close to me. So Springfield, like the rest of Massachusetts, has food deserts. What role would you play in providing greater access to healthy foods through additional supermarkets in this senatorial district?
That is a great question, because that's something that since I've been elected to the city council, have been working with the Department of Economic Development and also groups as Arise in the downtown district and Aqua to really have that conversation on where can we actually have these. I know that we were trying to bring one up on top of the hill across from STCC, where right now the Burger King was closed. That seemed to have collapsed. We also are, looking for to be able to find, where we have a lot of this blighted property, where we can create, these avenues and have the big Ys, create like maybe a smaller big Y, not something as big. So then traditionally, when we're bringing all this market rate housing down to the district, we can be able to have more access and walkability. Those are conversations that I'm having with some of these developers that are coming in, that are doing storefronts at the bottom with residential up top. And then moving forward in the other parts of the district, they tend to have the bigger supermarkets. They have the big areas where a lot of folks usually go spend their money. We want to make sure that economically it's feasible and that people can get to a supermarket where there's fresh food. And that's what makes sense. So because a lot of us now, we're trying to create walkability in Springfield.
Thank you very much. Okay, so we're down to 3 questions. Senator Welch.
I'll choose 7, please.
7. Increasing urban green and open spaces is one way for a city such as Springfield or West Springfield or Chicopee to increase public health outcomes and for folks to have access to community gardens. How would you support urban garden programs?
Well, urban garden programs are great programs, and we have tremendous examples of them here in Springfield. And I don't want to leave anybody out, but I know some people that are associated with this event tonight are strong supporters, and we're really the ones that got these programs started in the first place here in Springfield. The more and more that we can do, it accomplishes a few things. It's a local way to provide healthy food. It's a way to teach kids, especially the art or the trade of agriculture, which is something that will follow them for the rest of their lives. It's a win-win-win situation. We have to continue to support it, which I have. I'll continue to do so. I think that it's a tremendous program, and there's a few in the Hampden district that we can point to, that have been successful and are doing a great job. Like I said, I don't want to point any specific program out because I don't want to forget anybody, but Springfield certainly has its share of, but we need to do more. We need to do even more.
Thank you, sir. Okay, so we are down to the last 2 questions. Councilor Gomez, which one would you like? This will be your final question.
Such a hard choice. There's just 2 of us, so let's go 2.
Okay.
2.
So here in the city of Springfield, we have Gardening in the Community, which is, of course, a nonprofit organization that teaches young people how to produce food and subsequently also how to market that food to the neighborhood. On the other end of Springfield in the Orchard, we've got the Wellspring Group, who have built a greenhouse, and they are producing a number of different greens to sell locally, providing not only locally grown food, but also jobs. So this is a question that's similar to the one we just asked Senator Welch, which is how in turn would you promote the idea of getting more people like Gardening in the Community or more people like the Wellspring Group to be building agricultural facilities here in the district?
Well, that's something that is near and dear to my heart. One, creating jobs, but at the same time, creating co-ops. You know, Wellspring, you know, they grow a mean head of lettuce over there, and they do great things. And I'm, you know, very excited to be able to have partnered with Wellspring and that other organization that you have brought forth, the food bank, and also, you know, also the food pantry, which we want to make sure that in these urban areas that we create these gardens, they have access to water, because that's one of the things that I ran into down on Osgood Street when these farmers, these gentlemen, there's a flower shop that gives them the back part so they can grow lettuce and grows their vegetation. But for, I think, probably before I was elected, for about 10 years, still to this day, we get a donation of water from the firefighters. They'll come and they'll put water in these tanks. And that's something that we have to do, is we have to make sure that when we're creating these urban gardens, one, that they're sustainable, and two, that they have every single resource possible. And we have a lot of property throughout the city of Springfield that is really good places where we can start these initiatives. And I know with all of the organizations at the table, we can really get these things going, and this education, and making sure that, you know, the communities have access to one, water, but at the same time, those vegetables, and being able to and put those out into the community successfully.
Thank you very much. Senator Welch, you get question number 4, the last question.
All right, I'll go with 4.
Okay, you'll go with 4. Okay, from farm workers who grow food to the people who prepare food for market, and then for the people who actually sell food in stores, all of these people are essential workers in this time of the pandemic. How would you ensure that they have access to free and proper PPE, that they get testing for COVID, and they get childcare when necessary?
Well, all very important. And I think it was a great lesson for many of us in our communities. You know, unfortunately, you know, when COVID and the pandemic hit, and as people were being quarantined, we relied very heavily on people, you know, that fill the roles that you had just mentioned. And there's absolutely no reason whatsoever that PPE should not be provided. As a country, we were not ready to provide PPE to all of our citizens and our frontline workers. As time went on, Massachusetts was able to provide PPE. Again, I'm a big believer of bringing resources back to our local communities. The money for New North Citizens Council that we were able to secure recently is for testing and for providing PPE to some of our most essential and frontline workers. So I believe that that's without a doubt something that we should be providing and doing as a Commonwealth. And I've tried to put my money where my mouth is and bring the resources back home to be able to do just that.
Thank you very much. Gentlemen, we've exhausted all the questions, and so now we have time for a 90-second closing statement from each of you. And I'm trying to make this fair, so I believe since I think that we should have Councilor Gomez go right now with his 90, and then Senator Welch with his 90 seconds closing.
All right, thank you. First of all, I would like to thank everyone here for a fantastic discussion on the issues and how we can solve them. I know that traditionally sometimes, you know, us as legislators and no matter what level of government, it's hard to reach out to every single person all at once. I'm running for state senate because I was born and raised here. And one of the most impoverished areas of Massachusetts, where I have seen and lived the challenges our district faced in housing, economic development, and transportation, healthcare, and education. I'm running because I come from 5 generations of veterans, 5 generations of service. And I currently work as a property manager for an organization that works to transition our veterans from homelessness into housing. I have seen how homelessness impacts people and what it must be done at a local and state level. And I want to be that change agent. I'm running because I have a small business. I am a father of 3 who build sorry, excuse me. I'm a father of three, that I want to build a community where we can build good paying jobs people can get to, where everyone has a home in a safe and healthy neighborhood, and where everyone sends their school to a fully funded school. I know that this is a vision that isn't going to come true if we don't have someone who will fight for it. I'm running because that I have the experience and policy background and connection to the community to deliver all of that to the Hampden district. And I really humbly ask for your support on September 1st for change and a new direction. Thank you.
Thank you. Sandra Welsh, your 90-second closing statement.
Well, thank you, Mike. And again, thanks for hosting or moderating tonight. And of course, thank you to our sponsors for putting this together. A great event around a subject matter sometimes that doesn't get enough attention. And I think this is a great way to provide community attention to that. I'm running for re-election because I love Western Massachusetts. I love Springfield. I love Chicopee, and I love West Springfield. Born and raised in Western Massachusetts. It's as we know that it's a special place. People choose to live here because they want to live here, and as we as legislators know, every day you have to go down to Boston and fight hard to bring the resources back from Boston to Western Massachusetts and our communities and our programs here. I feel as though my record has shown that I'm very successful at providing these resources and bringing these resources back to our district and getting them into the hands of the people who provide these services on the ground level. My record, I believe, speaks for itself. I'm proud of it. And it's something that I work hard at every day to make sure that I'm doing the best I possibly can for the Hampden district and the people that live in the Hampden district. On September 1st, if, as we know, there's 3 ways to vote: vote by mail, vote early, or vote on election day. I would just ask everyone if they could keep me in mind and consider Jim Welch for State Senate for re-election. Thank you.
Gentlemen, thank you very much. Every election is important, and I hope viewers tonight have learned more about each of you and your candidacy and your positions and what you want to accomplish if you go back to the State House. Folks, the election is September 1st. Please vote. And here at Focus Springfield, we want to thank you for watching this evening.
Thank you, everyone, for tuning in tonight. Thank you, Mike Dobbs, for moderating. Thank you to Senator Welch and Councilor Gomez for sharing your views. I want to especially thank our co-sponsors, the Springfield Food Policy and Action Council, the Urban League of Springfield, and CISA. Thanks to Christina Maxwell for timekeeping, to Katie Moonen for translating, and for Focus Springfield for airtime and technical expertise. We have one more forum coming up tomorrow from 4 to 5 p.m. It's the 9th Hampden Forum featuring Denise Hurst, Sean Mullen, and Orlando Ramos. You can tune in on Focus Springfield, Facebook Live, or YouTube, and you can check the Food Bank's social media pages for more information. As was said, remember to register to vote by August 22nd, that's this Saturday, and to vote in the primary on September 1st. Thanks so much, and enjoy the rest of your evening.